Maaike,
Good
are you there?
morning. Yes, I'm here. Good
Good
morning.
morning. Thank you for making time for us this morning. Can you hear me?
Nice to be here with you.
Okay, great. Maaike, we appreciate your time, but what are the key goals? Let's start there in terms of the Immunization and Child Survival Forum. And why is it significant for sub-Saharan Africa at this particular time?
Yes, thank you very much. So this week we're seeing governments from around 20 countries that are coming together in Maputo to discuss how to accelerate the progress in reducing child mortality. And the reason why we're doing this now is that we are only 5 years away from 2030 when we want to reach the Sustainable Development Goals. And there has been a lot of progress in reducing deaths and particularly preventable deaths in newborns and children under 5 years of age. But still today, and every day, there are 13,000 children who die before they reach their fifth birthday. And 60% of them, so almost 8,000, live in sub-Saharan Africa. Now, we know what we need to do to prevent those deaths and also to treat most of the diseases that children die of. But we're not doing enough yet to make sure that every child receives those preventive measures and receives the treatment in time. And we all feel that every child has the right to reach their fifth birthday and to thrive beyond that into adulthood. So country leaders are coming together this week, together with health leaders, with researchers and other partners to look at the latest evidence, share experiences and learn from each other, and then make concrete commitments on how to further reduce child mortality in the coming years.
So progress has been made, but as you highlight, there are challenges. 13,000 children under the age of 5, 13,000 children don't make it until the age of 5 and they die before that. Can you highlight some of the most pressing challenges currently hindering access to immunization and child health services across sub-Saharan Africa?
Yes, so we're basically, I can mention three key issues. One is that there are huge inequities in countries. We see that children from low-income households and rural areas, they face higher risk of death before they're 5 years old. Also, children who are born to mothers with low education levels. So there is no what we call the universal coverage of health services yet. And we need to improve that, particularly for those most vulnerable populations. Then number two, the health systems in countries are not always set up in the most efficient way and sustainable way. Sometimes you have programs that run in a very vertical mode. Sometimes there is not enough emphasis in work in the community. So there is still room to improve the health systems. And then at this very moment, we are seeing a funding crisis in the health sector due to reductions in foreign aid. And that is particularly affecting countries that depend on this aid for their health expenditures. So it is important to strengthen that funding, and particularly when we know, for example, that every dollar that we invest in immunization brings $55 in return, and every dollar that we invest in nutrition brings $23 in return. So we know that there are solutions out there, and that we just need to apply them in an equitable way.
UNICEF is a core partner in this forum, as we mentioned earlier. What specific role will the organization play during this 3-day event?
So we've been supporting the organization of this event. We work in 119 countries across the globe, and also in these around 20 countries that are participating this week. We've been supporting these countries for years, and will also continue to support them when they go home and are going to act on their commitment. So we work on action specifically in this area for child survival and development. We support the design, for example, of relevant programs from the community level upwards, programs that aim to reach every child. We work to strengthen the capacity of frontline workers. We support innovation, including digitalization, but also different other innovations. And also what we call the last mile delivery, making sure that all the relevant supplies and items reach every household that needs it.
You mentioned digital innovations there. What can you tell us in terms of more innovations that are being launched at this forum and how those could significantly impact child survival rates moving forward?
Right. So there are different innovations that have been out there. For example, we have new vaccines now. Vaccines, for example, against malaria, against certain types of pneumonia. There are new tools to diagnose people with specific diseases that you can also use now in the community. There are medicines that are more and more made in a certain way that they're easy for children to take up. In the digital area, there's a lot of still room for improvement also with how community workers can use it, how it can be used to work with families. We're also looking at innovations, for example, in terms of funding. We're now talking about debt swaps and other innovative ways to get funding for the health sector. And then also, yeah, strengthening, knowing learning from each other. Many countries have very good practices, have very good learned how they can work with community health workers, how they reach children, how to reach the last mile. And we want countries to learn from one another.
Maaike, thank you so much for your time again and giving us insight into this very important topic.
Thank you very much.
Thanks. Maaike Arts.